Thank you, Chair. Just to confirm, the meeting is now live.
Thank you. Good afternoon and welcome to the Health Overview Scrutiny Panel. I'm Councillor Ian Holder, Chair of the Health Overview Scrutiny Panel. Members of the public are invited to view this meeting online. Those present are requested to keep their microphones on mute and only turn them on when you are called to speak. Members are requested to keep your cameras turned on at all times. Officers and external presenters are requested to turn your cameras on only when you are presenting their reports or answering questions. If you'd like to speak, please write your name and RTS request to speak in the chat function. I'd now like to invite those present to introduce themselves. Councillor Lee Mason.
Councillor Lee Mason, Cosham Ward, Portsmouth City Council.
Thank you. Councillor Matthew Atkins.
Yes, Councillor Matthew Atkins, also Cosham Ward, also Portsmouth City Council.
Councillor Judith Smythe.
Councillor Judith Smythe, elected ward member for St Jude Ward, Portsmouth City Council.
Councillor Rob Wood.
Councillor Rob, but Chair, as I've indicated, because I'm dealing with another video thing, my video line isn't streamed, but I'm here, Councillor for St Thomas Ward in Portsmouth.
Thank you. Councillor Arthur Agate.
Just take it off mood. Good afternoon, Chairman Arthur Agate, East Hants District Council.
Thank you. Councillor Anne Briggs.
Good afternoon, everyone. Councillor Anne Briggs, the Councillor for Hampshire County Council, representing Waterloo and North Stakes Ward.
Thank you. Councillor Trevor Cartwright.
Yes, good afternoon. Councillor Trevor Cartwright, Deputy Leader, Fareham Borough Council.
Thank you. And Councillor Lynn Hook.
Thank you, Chairman. Councillor Lynn Hook, I represent Gosport Borough Council. Thank you.
Now the officers and external representatives is Helen Atkinson. Would you like to introduce yourself?
Thank you, Chair. I'm Helen Atkinson. I'm Director of Public Health for Portsmouth.
Thank you. Dr. John Knighton.
Thank you, Mr. Chairman. Sorry, we're a minute or two late dialing. John Knighton, Medical Director at Portsmouth Hospitals.
Thank you. Chris Evans.
Hi, I'm Chris Evans, Chief Operating Officer at Portsmouth Hospitals.
Thank you. Paula Anderson.
Hello, I'm Paula Anderson from Southern Health. I'm Finance Director and Deputy Chief Executive.
Thank you. Lisa Gallagher.
Hello, I'm Paula Hull. I'm Director of Nursing and Allied Health Professions at Southern Health.
Thank you. So, Lisa Gallagher.
Hello, Lisa Gallagher from Democratic Services.
Thank you. And James Harris.
Thank you, Chair. James Harris, Senior Local Democracy Officer, Portsmouth City Council.
Yeah, thank you. We've had apologies so far from Councillor Rosie Rains and Councillor Roger Bentote. I'd like to ask if any members have any interest to declare, and I'll call you. Councillor Lynn Hook.
Thank you. I have typed it in. It's just one, thank you, Chair, on the item 5, the update from Southern Health NHS. I'm part of the Willow Group. I do volunteer down there 4 mornings a week, so I do know what's going on there. So I just thought I'd let you know. Thank you.
Thank you. No one else? Perfect. We'll move on to item 3 on the agenda, which was minutes of the previous meeting. I think a revised copy of the minutes was circulated via email to members on Friday with some minor amendments to the CCG item from Joe York. Councillor Mason, I understand you have a couple of amendments.
Yes, since the council laptop always decides to update at the time of any meeting, I'm sure it's been set to do that. I'm using a tablet, which is what I had all my notes on, but basically an action wasn't for me to get the prescription details. It wasn't a prescription issued by the pharmacy, it was a prescription issued by the hospital, but the pharmacy was closed at the time they issued it, and being a different colour, they were unable to get it as a normal NHS one, so I had to pay for it as a private one. And I wouldn't have been able to agree to give out details of a resident who's contacted me without the resident's agreement. And the other one was that there was supposed to be an action to invite us to Portsound Group. We haven't actually been invited yet. it was, we'll go away and get you an invite. So that I'd say is an inaccuracy as well.
Okay, no problem. Please, can I have a proposer and seconder for the approval of the amended minutes? Councillor Briggs?
I'm happy to propose that we agree the minutes.
Thank you. Councillor Wood?
Happy to second.
Thank you. So those are approved. Thank you. Next, item 4 on the agenda, Portsmouth Hospitals University Trust. I'd like to invite Mark Evans and Dr. Knighton to give a brief update on the report and let us know if anything's changed since the report was written. Thank you.
So, sorry, John, was you just going to come in there? I think we're both going to start off at the same point. I was just going to say, obviously, the report is there, really as read. Happy to take further kind of discussion and questions, really, as a consequence of that report.
Does anyone have any questions? Councillor Agate?
Thank you, Chair. You keep hitting that. The report was regarding the strain on the emergency department and QAH, and I noticed that I haven't seen a lot of publicity regarding the UTCs, but I've just wondered what percentage effect the UTCs have had on the demand of the emergency department.
So happy to come in on that. So we've obviously got a number of UTCs across our system. The UTCs continue to provide support for minor illness, minor injury, and have continued throughout the winter period. Now, what we have started doing is working collaboratively with each of the providers of those UTCs to ensure that we offer a consistent one, even in opening times, and actually the consistent offer in terms of what each UTC provides. So that has been working well in terms of then sustainability, but all the UTCs continue to see and support our urgent care system.
The point was that, have you any noticeable reduction with them in operation on your emergency department?
So I think that obviously they've been in operation for some time, so they are a kind of valuable contribution really in terms of that UEC system. And obviously the challenge that we potentially could have if they weren't there in operation, then we could see that demand come to the emergency departments.
So effectively, you are not keeping much in the way of records on their effectiveness. One of the other questions I meant to ask is, I note that you're looking to progress recruiting so that Petersfield can be open for a 7-day service. Have you managed to achieve that? Do you know?
So just a couple of points, and I think John wants to add as well. So we obviously, from a Portsmouth Hospitals perspective, we provide the UTC in Gosport. So we're not the provider of the other 2 UTCs that we have in the locality, but we do have obviously records in terms of the activities and throughput in terms of number of people that are seen at the UTC, particularly in Gosport, and we are working collaboratively with the providers of the other 2 UTCs in terms of streamlining that offer.
Thank you.
Dr. Knighton?
Thank you very much. No, so Chris has kind of covered it there, but no, we absolutely know, we have records on a daily basis of the attendees at each of those UTCs. But as Chris said, we are only the provider for the Gosport one of those 3, and obviously numerically the biggest contribution is down at the St Mary's site. the Petersfield site is a relatively small contribution. In terms of the impact that it has, therefore, it is much more limited than the other two. They have been in existence for some time. What we haven't seen through this winter is a significant step up in their activity to help reduce the numbers attending the QA site in a way that we might hope to have done, and I think the system would have hoped we would see. And on occasions we have, when there has been difficulty in staffing one or other of those UTCs, so particularly at the St Mary's site, we have seen a knock-on consequence of attendances at our emergency department.
So effectively, you haven't had a noticeable reduction in the emergency department at QA, even with these UTCs in operation. I would point out that the publicity regarding the UTCs does seem to be very, very scarce on the ground. If you only thought that perhaps more could be done in redirecting the public to the UTCs.
So can I start with that one again?
Yeah.
So firstly, I don't think I did, just to be clear, I don't think I said that there isn't a reduction on the impact on the emergency departments. If those were to close, there would be a very significant increase in the numbers of attendances at the emergency department. So they are a vital part of the provision of urgent care access for our community. In terms of the publicity, I would recognise exactly what you say. We from within the hospital have actually done quite a bit of publicity. We've been really well supported actually by the news, the newspaper, and their publicity in support of all of the different forms of access to some or the right form of urgent treatment or an assessment that doesn't necessarily require an emergency department presentation. But as with all these things, it's never enough, is it? And people still seem to sometimes choose a route that, even with awareness, isn't necessarily the best or optimal one for them.
Thank you.
Thank you.
Councillor Wood.
John and Chris, the reason I've got my video off is I'm watching out for my wife, who's in QA currently now. She had a mild coronary thing and she went in. A couple of observations I noted and she related to me that may be useful while you're at a busy time. One of the observations was when at a busy time, there were several occasions where elderly patients had gone in and where they're wearing masks, and because you've got a high number of nurses that may, at the sharp end, may have come from abroad, they couldn't understand what was being said, if that made sense to you. Now, I think that's really important because observation, my wife is very observant and observed many cases where misdirection, or if you like, time was taken up trying to convey a message between people. The other thing is about COVID. My wife went in there and later on she had to isolate because one of the people she was in with at the reception area proved positive with COVID. And that meant when she was trying to move through the hospital, she had to be in an isolated room, which meant it's taken since Saturday to today to get her onto the coronary ward in an isolated room. And basically that held up everything everywhere. So these are just observations I'm relating back that the COVID part through there, basically she was treated as if she had COVID, but she hadn't, if that made sense to you. And two is that has a massive impact with the movement through getting people throughput, if that makes sense to you. And I would say you would observe it. So the first point is that A&E, you have obviously I don't know where your other nurses go, but they move sideways, I guess, because A&E is so traumatic. And there was definitely an issue with communications. I'm relating this because it's brand new, it's hot off the press, and it's relevant to your operation.
So thank you very much for that, and I hope your wife is all right. The 2 points you raised there are they're absolutely relevant and well recognised. The difficulties with communication with masks, absolutely, and for those patients who are older and frailer and struggle for other reasons than that they've just got a face covering on, it makes it even more difficult, doesn't it? We absolutely do recognise that. And there's all sorts of things that are being tried in terms of different masks, clear masks and that sort of thing. But sadly, some of those are less effective than you might think they would be on paper and have other problems with them. In terms of the other point around the risk of in a hospital coming into contact with COVID, basically, and then the effectively the operational impact of having to isolate people because they've been in contact, that is a real challenge for us. And the higher the level of prevalence of COVID in the community, of course, the greater that risk. And as you will know, we've been up at, in Portsmouth, South East Hants, we've been up at a very high levels, 1,500 plus cases per 100,000 population, which is higher than we were even at the worst of last winter. So even though the number of COVID cases in the hospital may be relatively modest in comparison to last winter at 110 or thereabouts, the risks of everyone or anybody who comes into the hospital potentially being an asymptomatic carrier and then a contact of others is really high. So we changed our policy a couple of weeks ago, 2 to 3 weeks ago, and we are now asking everyone who comes onto the site as a visitor or a patient to have not just no symptoms and no temperatures, but doing a lateral flow test as well to be sure that, or as sure as we can be, that they are COVID negative and we don't increase the risk of contacts with others. And in terms of how we have to respond with when we have contacts, it is a really difficult scenario where we have to isolate people until we have demonstrated as a contact that they don't become positive, so that they don't risk going on and contacting others, but it does introduce a real constraint on our capacity.
Okay, thank you for that. And I guess what I'm trying to sort of say is those were two very real world problems that I would recognize straight away. Mm-hmm. And in the busyness, if you like, of trying to be all things to all people in the job, I really would think that perhaps time out should be taken so people can have a look at that process and decide the best way forward. All I'm trying to sort of say there, that was something very recognized that had immediate impact on a lot of areas. So even, for instance, somebody elderly who, and when they tried to take off the mask and step back, because there was a high number of nurses that were from, Africa, India, etc., they were trying to read the lips and couldn't read the lips. So just a simple little process like that, maybe have a apprentice intern who can cover those scenarios inside and mouth the words, if that makes sense to you, so lip readers could read that. So there were a set of scenarios that, if time could be taken to have a look at that process, would actually significantly help improve that initial take on. I'm only saying this because it's happened right now and it's fresh in my mind, and I think that's the best time to say these things with observations.
Thank you. Thank you.
Thank you. Councillor Briggs.
Thank you, Chairman. I'd like to comment, please, on the UTCs. I do agree with Councillor Agate that they're not publicised enough. I know several people have used the one at QA, and through 111, they've had an appointment and they've been absolutely delighted with the way it worked. They were in and out, seemed to, very quickly. The one at Petersfield, which I know you don't run, but it's my area, I visited it. Again, it's working well, but at the time of visiting, they didn't have a radiographer, so that made it very difficult after certain hours for people who arrived and couldn't have an X-ray. But my real question is, how are staff coping now? How's your nurses? How many are off sick? Because they've had such a stressful time. If you could tell me, please.
Shall I? Do you want to go first, Chris, or shall I?
I was just going to start. I think it's a very good question, and obviously The number of COVID waves that we've had has certainly taken its toll upon the workforce. This latest wave, we are now seeing, and I updated this for an internal meeting just this morning, that we've got a reducing number of staff that are absent due to self-isolation from the latest Omicron phase. So I think that was sub 50 this morning, and that's less than half in terms of where it was not so many weeks ago. So it's improving from, as I say, that self-isolation perspective, but it is fair to say that it's had an incredible toll upon the workforce. And obviously, as you would expect, there are a number of things that we're doing internally in terms of supporting health and well-being of our workforce. John, do you want to come in and complement that any further?
Oh, something's just fallen off my desk. Apologies. So just to say, in terms of that, that's staff sickness. Yes, so it has been quite significant, but it is coming down, as Chris has alluded to, and in percentage terms, we have got currently just over 5% of our staff absent through sickness, and that's in total, not just COVID. And that is less than it was, and actually we've been quite fortunate through the last month that our staff sickness absence, although it's significant and it impacts, it hasn't been as bad as some organisations. So we've got a greater base of permanent staff rather than temporary or agency staff, and that helps quite a bit.
Thank you, Councillor Hook.
Thank you, Chairman. I was just going to say on the other side that when the patients, and I was sent over by 111, I was COVID positive, and I've got to say QA were fantastic. They put me in a separate reception room, so when I was booked in at AE, and then put in a separate ward when I had to go onto a ward, and I couldn't fault them. I had 8 doctors and nurses come in and monitor me and stabilise me, and the system works, certainly when they know you're COVID positive, and I can't thank them enough. So yeah,
thank you for that, and I'm pleased to hear it. Thank you.
Thank you. Is that no more questions for anyone? No. Thank you, Chris and Dr. Knighton, for joining us today. You don't have to stay around for the rest of the meeting if you don't want to, so feel free to leave. Judith.
This is about the next item, Chair.
Okay.
I think
Chairman,
the next
thank you very
item is.
much. Thank you all.
Thank you. The next item is Southern Healthcare's report,
and
it contains a report of an inquiry made into health and safety and communications and complaints in the hospital. And at that time, I was on the board. I was a non-executive director, so I have a retrospective interest in that, and won't be participating in the discussion unless I feel it's right and proper in my new role. Thank you.
Okay, thank you for that. Paula, over to you.
Thank you, and good to see you, Judith. Accepting that you won't contribute, but it's really nice to see you. It's been some years now. So Paula and I are here to just to talk you through the external independent review that was undertaken into Southern Health by Mr. Nigel Pascoe. This it says most of this in the paper, but I'll just talk for a couple of minutes and then we'll open to questions. The purpose of this review was to initially look into the deaths of 5 people within the trust and concerns that the families had around the situation that they'd found themselves in, and the way that, just as importantly, the way they felt they were treated after their relative or loved one had died. And the original review by Mr. Pascoe looked at the individual situation around those individual patients, and the Pascoe 1 report came out some time ago now. As part of that work, we accepted fully the recommendations in Pascoe 1 and had obviously unreservedly apologised to the families and supported the second review, which was around understanding the work that we were doing now to improve in the areas that Nigel Pascoe had identified were failing when he did the first review. That was done very early last year. It started in the spring and involved a panel of experts, and they heard evidence from a number of people, some of whom were patients or carers or family members, and some of whom were experts within the NHS at understanding how good investigation systems work or how good complaint systems would work. As a result of that, we have a published report with a number of recommendations and learning points, which the Trust has responded to. A summary of our response is in the papers that you have there. And we're here really happily to answer any questions that you may have. Understanding the recommendations, clearly this is an area of work that Southern Health, as you'll be aware, has been trying to improve in some of these areas for some time. So some areas we've been working on for a number of years. There are some really specific actions that we've identified in this response that we are actively doing right now, and you'll see from the timelines are all due to be finalised within the next couple of months. And then there are some really important aspects that actually the work never stops. We will always be looking to improve how we work with patients and their families, how we resolve complaints as quickly and effectively as possible, and making sure that that's done with families in a way that they're very comfortable with. So some work will always continue, and the important thing for us in those areas is how do we set up really good systems to make sure that we know if it's going off track or if something's going wrong, that we know about it quickly and we can do something positively with people to resolve that. So that's effectively where the report is. I'm really happy. Paula and I will take any questions on this or answer any points of clarity. Thank you.
Councillor Agate.
Thank you, Chair. What can I say about that independent investigation report? Right, first time. Congratulations. That is one hell of a report. 10 pages, and at some point in time, presumably, you're going to come back to us and tell us how effective it's been, because every page I look down, I see people who's going to be feeding us information because there's action. Every page you are actioning what's going on here. I think that's pretty fabulous, to be honest. One of the things that I did pick up somewhere, something about failed recruitment. How's that going?
Okay, so thank you, Councillor Agate. Thank you for that feedback. Yes, we have put a response in for all of our recommendations, as you can see, and some of them, as I said, we are already working on, but there are more. There's always more to do. Recruitment is without doubt the biggest issue within the NHS at the moment, and it's particularly tough, I think, in mental health. And we are doing our best on it, and we're always looking for ways to improve that, either through better retention or improving the ways that we reach out to people to try and encourage them to come and work for us. But there is a limited amount of people out there who want to work in our environment, and it can be really challenging. But it's probably the most important thing that we do every day to support our patients, is to make sure that we've got the right staff with the right qualities, who do jobs that they can do and that they enjoy. So it's the top priority within the Trust.
Thank you. Councillor Wood.
Paula, just looking at your report again, it is a very good report with a lot of actions. But looking specifically at R13, which is about Health Watch, working with Health Watch. Obviously, I've joined that group many times when I can, etc. And it's a good group for feedback. But sometimes matters don't carry from one to the next meeting because they don't meet often enough. So the main thing I'm worried about is I think you do get good quality feedback, but I guess in liaising with that, there's an onus on yourselves to hold if you like, the feedback you've got to move it forward, because by the time it gets to the next Health Watch, there's a whole list of other things that they're going to deal with. So you understand what I'm getting. If you're going to use that as a method to improve your services to service users, you almost need to sort of say it's not just attending the meeting, but using the framework to report back some improvements on particular areas. I think that would be brilliant, because in a way, it's like this meeting. We're going to say a load of stuff, and by the time we come to the next meeting, that load of stuff, there's a whole new agenda set of items to go in, even though we go through the minutes. So I'm just worried that we actually utilize the feedback because you clearly have picked all up the good stuff there and improved it. And it'd be great if you, in the minutiae, if you understand what I mean, you use that service feedback.
Thank you.
Thanks, Paula. Yeah, just to let you know, Health Watch, actually, we're very lucky. We've got a working in partnership committee with a range of different people from different voluntary sector organisations that work with us to support this work, and Health Watch are part of that. So it isn't just us going to meet them at their meetings, which, as you say, are perhaps not as regular. It's also they are involved internally within the trust in some of our committees. And also pre-pandemic, they were actually doing a piece of work for us where they were going into our inpatient physical health wards and surveying people and asking them how they felt and what their feedback was. We've not been able to do that, I'm afraid, during COVID, but it was definitely something we were partnering, and it was really, really quite successful before COVID. So absolutely working with them in many different ways.
And I think as well, linked to your point and the earlier point, we'd be really happy to come back into a future meeting of yours to talk about the things we've actually done. So we know this is the plan and we're moving forward with many things, but I'd really like to come back in, say, 6 months' time and just talk through where we've got to with it all, if that would be welcomed.
That would be brilliant.
Yeah, thank you. Councillor Briggs.
Thank you for your presentation in the pack. You've got so many different timelines. Are they all going to be achievable? And say for the first timeline, is the patient hub now open for patient and carers? So hopefully if they can talk to start with, you won't get to the state that's been happening with the five people, the five families. Yes. And how's the duty of candour training going?
Thank you, Councillor Briggs. Yes, I agree that we have got numerous timelines. Our intention is to achieve these timelines. We are going to take, in terms of governance, we're going to take it through our Quality and Safety Committee over the next 2 to 3 months, and talk in our public board in March about where we're up to. I'm really, Paula will be able to give you more details, but I'm really pleased to be able to say that the Patient and Carer Hub is up and running. And you're right, that's such an important point, and it runs through some of the, certainly at least in one of the themes, it really runs through everything, doesn't it? If we can get that hub working well and people know about it, then it will really support us in being able to solve people's problems much quicker, and also, you know, resolving it with teams where there's issues there.
Yeah, really pleased that we've had a huge amount of co-production on setting the hub up. So it's the people that we're working with, carers, service users, families who told us what it needed to be called. They've told us how they want to be communicated with. They've told us the technology they want us to use, and we're working together on it, which is really great. And there'll be an evaluation. So we're going to pilot it. We're going to evaluate it. We're going to seek feedback from people about how it's working, things that are good, things that don't work, and we will adapt it as we need to based on people's feedback. So yeah, really good. The duty of candour training you mentioned is also going very well. What we found is our original training wasn't practical enough, and it didn't really bring to life some of the scenarios that our clinicians are working with every day. So we've adapted it and changed it and got some really positive feedback about the fact that it's much more practical and it's helps them with actually their daily work. So it's going very well.
And one of the issues with duty of candour is, you know, the legal requirement is a minimum, really. It's where we want to be is we want our staff to feel confident about just being able to be transparent and open with patients and their families or their carers about things that have happened, and to be empathetic and to be able to approach those conversations just completely openly and honestly, and that to be just really running through us like, you know, a piece of rock. You get it, you know, it runs all the way through, and that's the culture that we want in our organisation, and we're making really good progress towards that. But there are sensitivities sometimes, and Paula's point about the practical, you know, sometimes it's about how a member of staff feels about confidentiality and what a patient may have said about things they want to be confidential, and how staff members can understand that properly with the patient and really understand which bits can be shared with the family and which bits can't. And it's those sorts of complexities that we have to really help staff with, because it's not an easy one, and the training will really help with that. Thank you.
Thank you. Are there any more questions from anyone? I think it would be good to maybe come back in 6 months or so we get an update on how things have gone.
Good pleasure.
Thank you. As before, don't feel you have to hang around for the rest of the meeting, but thank you.
Enjoy your meeting.
Thank you.
Thanks. Bye.
And we'll move on to item agenda 6, which is Helen Atkinson. If you could give a brief update on the report and let us know if anything's changed. Thank you.
Thank you, Councillor Holder. So this time, I hope you can hear me. I unfortunately broken my headphones, apologies. So I've done the normal presentation update just on the main services that we deliver as a presentation, but I also thought it would be helpful this time because you'll be very aware that obviously for the last 2 years, the public health function in the council has been incredibly busy. Delivering, obviously advising, delivering specialist advice, but also we deliver the testing, asymptomatic testing service across the city. That's mainly from the Somerstown hub, and also we do drop-offs to community sites, and where we've got major outbreaks in schools, etc., we do drop-offs. But we also do the contact tracing, deliver the contact tracing service for the city, and spend quite a lot of time. We also have a public health rota, and I know it's in the slides, but just thought it'd be interesting to share one of our recent assurance reports. So Councillor Smythe is actually on the local outbreak engagement board for Portsmouth, but we meet monthly. So we meet weekly as a health protection board, which is all partners across Portsmouth. When I say all partners, it's the main big employer partners in terms of the NHS, the police, fire service, obviously also then services within the council, our support for business, education, etc. So we meet weekly to go through all the key current risks in the city around COVID. And then monthly we meet with the local outbreak engagement board, which has obviously councillors as well as other representatives from education, etc. So I thought it'd be interesting to give you a brief copy of the assurance report, which went to the last meeting, which unfortunately the data is already out of date, which I'm sure you all recognise because things move very, very fast. So the last meeting was on the 7th, but just as background, so you can see some of the things that we've been doing. Obviously, what has changed is that it's a slightly, dare I say, a slightly better position we find ourselves in this week in many ways, in that we are seeing a reduction in the community infection rates from COVID. We are still seeing, however, quite a lot of outbreaks, particularly, so we're still managing, working closely with our colleagues in the CCG, Portsmouth CCG, and obviously in adult social care. I think we've still got 17 outbreaks within our care homes, so that's out of 39. And we are seeing significant, because I think it's fair to say schools, and particularly primary schools and nurseries, are probably what we'd call about 2 weeks behind in terms of the outbreaks and the risks that we've seen in care homes. So we've started to see from last week, so schools have been back 2 weeks, then a huge increase actually in school outbreaks. So this week we've dealt with about 15 or 16, and last week similar numbers. So although it's an improving picture, it's fair to say there's still quite a lot of risk out there in terms of community infection rates. I think that backs up the point that John Knighton was mentioning in terms of the risks of people going to hospital. But it's much better position than it was in that assurance report. And you'll all be aware, of course, that communications teams have worked across, I mean, we work across the whole of Hampshire and Isle of Wight in terms of the work we do with the local resilience forum, and that includes how we work across the communications with our colleagues in the police, fire, etc. So comms teams have worked incredibly hard to ensure, and it's something I know that Judith feels quite strongly about, that the communications is updated very rapidly to ensure that our residents know what's happening. And that has been very challenging in the last 2-3 weeks because the guidance is changing so rapidly. So that's kind of an overview. Happy to take any questions.
Councillor Agate.
Thank you, Chair. One question, one complaint. I note the contact rough sleepers drug and alcohol team. You mentioned progress in that. How is that proceeding?
Just on mute, apologies. So lots of, sorry, I still don't always forget to unmute. So it's fair to say it's always challenging, but there have been some things that you could argue, much as it has not been an easy time over the last 2 years. There have been benefits from some of the response, which has been to enable particularly our homeless rough sleepers. And although, can I just point out the bit that we do is obviously the health bit. Obviously, it's another direct lead on housing, but having our homeless population housed during periods of their outbreak has been really helpful. So it's meant that we've actually managed to deliver services that we wouldn't necessarily be able to as easily deliver. But I think it's one particular thing that you're always interested in is the work we've done with our homeless rough sleepers around some of the what we call prevention areas. So we've managed to do some really good work, particularly around vaccinations. So it has meant that it's been easier for us to target our vaccination programme because we've been able to go into settings. We haven't had the opportunity, and that's because of the pressure in the NHS, to return to do what we call our bloodborne virus screening. So we did do that when they were housed last year, which was really effective, and we did manage to identify people with Hep C and who then went for treatment and follow-up. But it's fair to say that is that the bit that you particularly mean in terms of some of that screening? Yeah, there's also been some progress because we've been very successful in Portsmouth to be able to bid for additional funding, which has supported the CCG to deliver the homeless healthcare team, which has been very effective. And we've bid again successfully, but we just haven't managed to recruit yet to some serious mental health support. So with key workers and specialist workforce there. However, it's fair to say, much like previous speakers have said, the NHS is under such pressure, particularly around workforce, that it is quite difficult to recruit at the moment, particularly if it's not necessarily COVID related. So we are still out to recruitment for some of those specialist posts. So I'd say there's some good news. And actually we're just starting the process for our substance misuse service to go through procurement, which has just started, and there's quite a lot of information out for consultation at the moment and getting ready for the bidding. I'm happy if there's anything other specific.
So you're going in the right direction. Okay. Can I now address you to my complaint?
Mm-hmm.
That's wider determinants. Could you please use larger readable fonts? The size on this is more suitable to Lilliput than it is to a normal human being. Go on.
The actual specific side, I completely agree with you. I'm afraid we and I do apologise. I don't think there's anything else I can apologise. I think the team, the people working on that programme have been working very hard, but I will for next time ensure that we actually get And I think they were keen to be able to show progress, but you are right, the slide isn't very helpful. So I'll get them to put it into 2 or 3 slides for the next update. No, that's a very, very fair challenge.
That's great, thank you very
And
much.
if that's your only complaint, I'm relieved.
Trust me.
Thank you. Councillor Hook.
Thank you, Chairman. Yes, I was actually going to mention that as well. My eyesight's not as good as it used to be, and I found it quite a struggle to have a look at that. Just going back to the schools, obviously with the vaccinations going into the schools, I'm just wondering how, and I know I'm in Gosport and obviously you're in Portsmouth, how the junior and infant schools are faring over there. I mean, because obviously they haven't got the vaccinations necessarily.
No, yeah, and that's a really good point. So currently, obviously, the vaccination, you're only eligible for vaccination from 12 and above. So the schools programme for second vaccinations has started now. That's going really, it's going really well. And of course, obviously, over 12s can go into walk-ins. They don't even actually have to make an appointment, which is good. We are seeing, therefore, though, so it's the under 12. So currently, JCVI, the Joint Vaccination Immunisation Committee, who make recommendations to the NHS on who gets vaccinated. So you can't vaccinate until till the decision's been made by the JCVI. They have recommended just actually for 5 to 12-year-olds to be vaccinated in those that have serious underlying health conditions, or if they're immunosuppressed, or if they are living with somebody who is immunocompromised. So that programme is the next one to be rolled out. It's likely that the planning is just starting, and the planning is likely to be, I think the delivery will be in primary care, because that's where the information is held for children, whether they have an underlying health condition, and it's quite small numbers, which is why it won't be going through the schools programme. And we are therefore, and you'll be seeing it in Gosport too, Councillor Hook, we are therefore, that is why we are seeing, I think, such high numbers now of infections currently in nursery and in infant and junior schools, and that's where we're seeing most of our outbreaks. There is also, I'm probably adding a little bit additional information here because I'm conscious it has been in the news, but we are seeing an increase in hospital admissions for under 5s, particularly in babies. But I want to give you some assurance it's not because necessarily those children, so we are seeing greater infections in that age group anyway, but it's not that they're any more seriously ill. There is rightly so in place, a paediatric fever protocol pathway, which means that when children of that age go into A&E, they pretty much are always admitted. It's a cautionary pathway because of sepsis in that age group. So it just means that, and unfortunately the data's gone out there now, and I think people have read it, seen it in the news, and got quite concerned. But it is mainly to do with that pathway, and we haven't had any necessarily serious illness in that age group. But yeah, so I think they're each wave tends to have impacted on different age groups, and it's fair to say because now the vaccination programme has been so successful and we've seen such good uptake, there's still some hard to reach areas, and we are still seeing quite a high number, particularly in young adults, that are not getting vaccinated. So in your roles as community champions, really, if you can encourage everybody to have that vaccination, that would be good, because it's still very much now people who there's still a few people who've just recently had COVID, so they're having to wait for their 3 months, but there are still a number of people out there just don't seem to want to have the vaccine. So we're really trying to encourage and support people, bust the myths, and give people the best information and intelligence to make an informed decision and encourage. But we are seeing that particular age group in this wave being quite affected.
Okay, thank you. Thank you for
that. Councillor Smythe.
I think Helen Atkinson said most of what you need to know about homelessness, but in Portsmouth we have made some very particular very good improvements in the service for street homeless people, many of whom have mental health and substance abuse problems, and some of whom have been rough sleeping for long periods. Our service is well thought of, and we've received good central government grants. We're well governed by a cross-party interagency working group that I have to say is something I'm proud to have been part of. We have reduced the number of street homeless considerably, and those who are still street homeless have various personal reasons why they want to do that, and are being well supported with public services, including mental health and substance abuse services on the street where that's possible, which it mostly is. And I think that's really a big improvement. And I think that will be, when we look back, something that we'll say COVID and the need to bring people into a series of hotels that we commandeered and took over at the beginning of COVID has had a good outcome for many of those people. And we have a pathway with 3 distinctive steps in it based on ability and needs and attitude and behaviours and things. And in the main, that's working really well. I would commend you to have a look at it if you're wrestling with street homelessness in your own area, because I think we are being seen now as a bit of a national example. And interestingly, the levels of COVID and outbreaks of COVID have been not as great as you would have expected in the homeless population, whether you pick up a lot of immunity from being on the street, as I hope I do by swimming in open water quite often. I don't know, and it'd be an interesting research project for somebody to do in the future, I think, Helen, wouldn't it? But meanwhile, we have just received an additional grant to give street homeless people access to inoculations. And I think that grant's got to be spent within the next 2 or 3 months. And my guess is that if any of you had street homeless populations that badly needed to be inoculated, it might be worth contacting Paul Fielder in the housing department, because we are scraping the barrel to find people from that population who need the jab, and we do need to spend the money. So the voluntary organisations that are helping with homelessness across South East Hampshire are involved and may already have accessed some of that. But like all of you, we don't like to see money granted to us for a very good purpose having to be given back. So contact Paul Fielder, who's oversees that team in Portsmouth City Council. Thank you.
Thank you. Councillor Wood.
Helen, you're the guardian of public health, so I'm going to ask you a difficult question, which is, with the fact that 109,000 cases on the way down is just as potent as 109,000 cases on the way up, and school children are going to drop the mask, and I know, being a governor and also having the children's education portfolio under my thing, what are you going to be looking out for? I guess what I'm asking is how are you going to protect us if things are wrong? In other words, I am not convinced, and a lot of teachers are saying they're being put at further risk here. So how will you monitor that, and what will you do if that proves the case?
Well, as you would expect from Public Health, Councillor Wood, we are still very cautious and taking a very cautious approach. We have a monthly IPC meeting, infection prevention control meeting, with the school heads, and as you know, the education team do actually meet with heads every single week. So although the guidance the government guidance has changed, we work very, very closely. We actually, all DPHs met with the Secretary of State for Education this week. We will continue to take a cautious approach. So therefore, schools that are in outbreak situations will be encouraging that face coverings are still used in outbreak situations. But we've worked really well with the schools in Portsmouth through this last 2 years. Much as the NHS gets a lot of focus and have worked incredibly hard, and I don't want to undermine that, I think education has worked incredibly hard. So we will be sharing a letter. So we're drafting a letter today for schools to send to parents to basically say we will be continuing to take a cautious approach and encouraging and supporting schools where they want to put preventative measures, or continue, rather than put them in place, to continue with them. They've worked incredibly hard on ensuring that they are following, all of the guidance in terms of keeping schools clean, different starts, And although we're not using bubbles anymore, they are still keeping classes separate. So they're doing everything they can in terms of those preventative measures. The other thing we're working really hard on, because there's still some teachers who haven't been vaccinated, to encourage all staff to be vaccinated, because they really are very much like the NHS in the front line. So even though the changes were made, I think it's important that those were all, when they were, all of the, at the PM announcements last night, it was that this isn't over. And I would like to say that, COVID pandemic isn't over. We are moving from plan B to plan A next week. However, that doesn't mean it's really then up to guidance and choice. So it's really about encouraging people still to be as safe as they can. So particularly if they are going to be visiting vulnerable people, we'll still be offering, tests. So I think we're still taking a very cautious approach, Councillor Wood, to make sure that we're protecting children who obviously go home to families, and there will be, more vulnerable grandparents, but we're also supporting those schools to keep the measures that they feel they need in place.
I'm very glad to hear that, because obviously clearly also they've identified a second strain of Omicron in Denmark, I believe, which is supposed to be a bit more virulent, but might not impact. So what I'm saying is it's still a big breeding ground for mutations currently out there.
And you'll remember that we were starting, unfortunately, it's my world at the moment, so we were starting to relax and think, we're in a better place if you think about it, just before November last year, and then we got the Omicron. There will still be other variants, but, I don't want to be all doom and gloom, because things are looking better, and a lot of that is to do with the success of the vaccination programme.
Thank you.
Thank you. Councillor Briggs.
Thank you, Chairman. I know schools have so much to worry about at the moment, but childhood obesity is a very real problem, not just in children, but in families. So how is your family weight management via wellbeing service? Is that working well?
Yes, it's a really important point, Councillor Briggs. And actually, we're hearing, we've all been through lockdowns, and we've all been through the last 2 years. And I'm sure, I can sit here saying that I have, gained a little bit of weight. I'm still exercising, but we know that probably childhood obesity has probably almost doubled in terms of in the last 2 years nationally. And we also know, I still think that's the important thing. As we come out of the pandemic, we are going to be dealing with much worse situations than we were when we went in. So in terms of what we would call, the inequalities agenda, I think we've seen greater what we would call the unhealthy behaviours, unfortunately. So obesity growing. We know that there is more what we would call unhealthy levels of alcohol. And also physical activity did improve, actually, interestingly, in the first lockdown, when everybody was actually locked down and not going out, about people were exercising more. So with all of that focus, and it has been a little bit more difficult because our team, which does one-to-ones, group support, have obviously had to change how they work. They are back to seeing people face-to-face now, but obviously they had to go on to telephone and video calls. I think it's important, although that service is there, and I'm not saying it's not effective, the reality is it's a great many risk factors or things that contribute to people in those behaviours. So you'll be aware it's not just a service, because actually it's almost too late once you've got the service, that we do have good numbers through and we are seeing a lot of people, but actually we've got to tackle, which opportunity to mention our refresh of our health and wellbeing strategy, which is it's about to be published at the next Health and Wellbeing Board in Portsmouth. We've actually decided we're taking a focus on tackling what we call the causes of ill health. So we're really looking at education, housing, poverty, employment, and really trying to work as a city, looking as particularly at ourselves as big employers and as what we call anchor institutions. So have we got the right strategies in place, for instance? So we're working closely with the NHS, with business, with education. but we're really trying to change people's life outcomes. And the reality is, if you, and it will be the same in all of our areas, if you are growing up or live in a more deprived area, you're more likely to have poorer health outcomes and ill health and disabilities, or factors that impact on your life chances, but also your quality of life, and you're going to die earlier. So that's what we're really trying to do, which includes obesity. So really focusing on the actions, but just putting a service isn't enough, and just telling people they need to lose weight isn't enough. We have to actually change people's lives, and so that's why we're doing the cause of the causes. So it might be obviously that's going to the Health and Wellbeing Board, but you might want to look at the refresh strategy, which will be published at the end of this month. I think it's early February. Yeah, might want to bring that here.
Okay, thank you. Because I was just going to say that they think obesity is now going to overtake smoking in danger to health, isn't it? So thank you for that. Thank you.
Thank you. Councillor Agate.
Thank you, Chair. I'd request that all this talk of obesity and dieting and health, please keep your voice down a little bit. My wife's on a diet kit at the moment. I don't want that transferring onto me. The other point was about the aggressiveness of people at vaccination centres. I mean, I took my wife, who's extremely vulnerable, up to Petersfield for her 4th injection, and said, I'm not on the list, was immediately given a form in my hand and shoved through the door. So, I suppose it was very caring, but there you go. It's you too can be shoved through the door, have your 4th injection.
Thank you. Any questions for anyone else? No. Thank you, Helen. The last thing on the agenda today was the dates for the future meeting. They were listed on the front of the agenda. Is everyone happy to agree those dates? Perfect. Those dates are agreed then. And that's it. That's the end of the meeting today. So thank you, everyone. Nice quick one. And the next meeting, I think, is Thursday, the 17th of March. So see you all then. I would just remind people not to say anything until the live stream's switched off. Thank you. Thank you, James.
Thank you, Chair.
Thank you.
Thank you, Chair.
Thank you.